Hello, psychologist Yulia Latunenko is here with you, and today I want to tell you how to cope with anxiety. Many people suffer from such anxious states, which sometimes even lead to panic attacks and psychosomatic illnesses. So today we'll figure out what anxiety is and what ways and methods exist to deal with it. If you haven't subscribed to my channel yet, please do so. This really helps my channel to grow on YouTube and also allows our fellow countrymen to discover this useful psychology content more quickly. The main thing you need to understand about anxiety is that this state is not connected to reality. It is not connected to the present moment. It is very detached from the here and now. This state is more related to the fear that something is about to happen in the future, that something terrible is bound to occur. And this is a state that is connected to thoughts about the future. Sometimes this state is not connected to any specific thoughts. It can be like a habit of worrying that formed, for example, in your childhood, when your mother was anxious or one of the significant adults was very anxious, controlling, or you witnessed arguments between your father and mother and were very afraid. Or you yourself were the victim of some physical or psychological attacks from significant adults. And then in this way, a habit of worrying is formed, a certain state that already becomes part of your personality. And for example, such an indicator is when anxiety already has a very strong impact on the quality of your life. For example, you wake up in the morning and already feel some kind of internal anxiety, like a sense of worry. You've just opened your eyes, and that familiar state of anxiety is already there. And this suggests that you might have an anxiety personality disorder. I highly recommend that before you try any of the methods I suggest in this video, you first consult a psychiatrist to determine whether you have an anxiety disorder. If the psychiatrist does determine that you do have an anxiety disorder, then it is recommended that you use medication therapy. Don't be afraid of this, because sometimes psychotherapy in very serious cases can take a very long time to work. And that's time from your life. You already want to live a quality life. You already want to enjoy the sunshine, the sky. You already want to feel calm. So taking some medications for a few months will not, on the contrary, it won't harm you, it won't ruin your health. On the contrary, it will actually give your psyche a chance to rest and recover. So don't neglect this method of coping with anxiety disorder. But I still suggest not making this diagnosis on your own and consulting a doctor. Usually anxiety is connected to deep-seated experiences that a person may not be able to consciously recognize. That is, there are certain feelings or information in your subconscious that you cannot bring into your conscious mind on your own. Therefore, if you have tried many different techniques and methods for dealing with anxiety, but you still feel that you haven't freed yourself from this very unpleasant experience, The second thing I can recommend is to consult a specialist who works with anxiety states, that is, a psychologist. First, we have a psychiatrist, and second, a psychologist. So don't delay, don't downplay the dramatic impact of childhood traumas that exist in your adult life. Try to make use of the services of different specialists. Well, if you don't have that opportunity, for example, if you don't have the finances, because these services do cost quite a bit, nowadays psychologists and psychiatrists do require a financial investment. So I want to offer you a few points, which I will now mention, that can help you cope with anxiety in the moment. But as I said, if we are dealing with an anxiety disorder, then techniques and methods alone will not be enough. Unfortunately, that's the reality. But in the moment, you can help yourself. So the first thing we have is our wonderful tool that helps us cope with anxiety. This is the tool that no one can ever take away from us as long as we are alive. It is our wonderful body. So, what should you do when you have an anxiety attack? Or when you wake up in the morning and feel everything inside you is trembling, anxious? You need to focus on your body, and more specifically on breathing practices, that is, on your breath. I suggest observing your breathing, how the air enters your lungs and how it leaves, making the inhale a bit shorter and the exhale slower. I've mentioned before on my streams that there are certain techniques that relax the body and specifically help to cope with tension, stress, and anxiety. These are breathing practices used by body-oriented psychotherapists, and I'm going to tell you about one of them right now. The first thing you need to learn is to breathe not with your chest, but with your belly. To do this, place one hand on your chest right here and the other hand on your belly. And try to use this hand to stop the movement of your chest and focus on how your belly inhales and exhales air. As you can see, my chest is not moving and the breathing is happening with my belly. When you learn to breathe with your belly without using your hand, you need to learn to count your inhales and exhales. But how? On the count of 1, 2, 3, you inhale. 1, 2, 3, inhale. 1, 2, 3, exhale. And you do all of this with your belly. 1, 2, 3. Inhale, 1, 2, 3. Exhale. You do about 5 cycles of this kind of breathing. Internally, you count and the duration is 3, 3. Next, you increase the length of the exhale. 1, 2, 3, inhale, 1, 2, 3, 4, exhale, 1, 2, 3, inhale, 1, 2, 3, 4, exhale. You do 5 cycles, then extend the exhale even more, 1, 2, 3. Inhale, 1, 2, 3, 4, 5, exhale. Again, you do 5 cycles of this. If possible, increase it to 1, 2, 3. 1, 2, 3, 4, 5, 6. And then we go back the same way we came to this point. 1, 2, 3, inhale. 1, 2, 3, 4, 5, exhale. 1, 2, 3, inhale. 1, 2, 3, 4, exhale. Do 5 cycles. And at the end, we do 1, 2, 3, 1, 2, 3. Another breathing practice that will help you get rid of anxiety comes from yoga. I do it very often when I need to relax. You close one nostril with 2 fingers, as I'm showing now, and you can close the other nostril with this finger. You inhale through your left nostril and exhale through your left nostril. Then you close your left nostril, inhale and exhale through the right. Next, again, inhale and exhale through the left, inhale and exhale through the right. You can also do another variation, one variation of this practice. Inhale through the left, exhale through the right. Inhale through the right, exhale through the left. And in this way, you sit, breathe, and focus specifically on how the breath enters and leaves, how the air moves in and out of your lungs. No thoughts arise in your mind during this. You are focused only on your body. This is your main instrument. This is your main pill against anxiety. In this way, you bring yourself back to the here and now. And this is our main goal, because anxiety states are precisely connected to the fact that we fall out of reality. We end up either in the future, where we imagine certain troubles or problems that are supposed to happen, or we project this anxiety from the past, the anxiety that formed in us as a result of childhood traumas, as a result of our upbringing, as a result of the models our parents showed us. We project this anxiety into the here and now, and we simply fall out of reality. We are either in the past or in the future. We do not live in the here and now. In the here and now, our life turns into suffering. That's why I say that the main thing when we work with anxiety is to return to the here and now. And for this, we have a wonderful tool, our body. What else I want to point out, so that you can manage your anxious states, is your thoughts. If you have anxious thoughts, obsessive anxious thoughts, this may also be related to the fact that you have this obsessive compulsive disorder. We mean OCD, which everyone knows about, right? Well, in this case, when we talk about thoughts, these are obsessions, obsessive thoughts, intrusive ones, what we sometimes call a thought mixer, right? So here it is important to work with these thoughts. And what can we do to distract ourselves from intrusive thoughts? Well, try fighting fire with fire, as they say. Try simply naming the things that surround you. For example, I see in front of me a wall that's painted with an interesting color. I see a painting with 3 rabbits. I see a vase with flowers. I see a table standing in front of me. I see a blue kitchen on the screen in the background. I see that bright sunlight is shining through the side window and clouds are drifting across the blue sky. In this way, you simply describe everything you see for a few minutes, trying to channel your intrusive thoughts and kind of turn that obsessiveness into repetition, right? That is, you repeat everything that surrounds you and focus specifically on observing the things you are naming. What else? You need to learn how to comfort yourself. If something has happened, we all experience stresses in life and the feeling of anxiety intensifies. So I suggest connecting with your inner self. As we say, this can be contact with your inner child. What does a child need in childhood? So that the mother comforts the child when the child is upset, crying and sad, but an adult no longer has a mother. An adult should already know how to comfort themselves. So start talking to your inner child or to your inner self. As I mentioned before, this method is called mentalization. When something happens, some kind of stress, you tell yourself, okay, stop, calm down. Now we're going to the cloakroom. We'll put on our jacket and go outside for some fresh air. Or for example, now we'll go to the boss and have a talk. Everything will be fine. Calmly, we'll talk about our expectations, about our dissatisfactions. Yes, calmly. Now I'll go to my husband and, well, I'll try to build a dialogue with him, to listen to myself, to talk about myself, about my feelings. In this way, in different situations, you need to learn to comfort your inner child. Then your anxiety will start to decrease in intensity, little by little. But I want to emphasize again that all these practices and techniques are just a kind of first aid, which will solve the problem only situationally. But the work you need to do on a deeper level requires time and, of course, investment, your effort and your motivation. Let's move on. Now, let's look at what other causes there might be for anxiety states. By understanding these causes, we can approach solving this problem more consciously. So, as I mentioned at the beginning of the video, sometimes we don't realize that anxiety is caused by fear about the future. And the feelings that cause such anxious states are these three feelings. Well, actually, I'll probably name 4 feelings. And the first one is fear. What kind? Usually it's an irrational fear, because what we are afraid of might happen, or it might never happen at all. And that's why you need to realize that this fear is irrational, and that here and now there is no threat, and we will deal with this problem if it happens. If it doesn't happen, then everything is fine. And in the here and now, we don't have this problem, so we return to the here and now. So the first feeling is fear. The second feeling that can lead to anxiety is guilt. Very often people tell me how they are afraid to say no, afraid to refuse other people. They are afraid to show their boundaries, their personal boundaries, and so they stay silent, violate their own boundaries, break them, and endure this kind of violence against themselves, just so as not to offend someone, so as not to feel guilty later if they say no or stop. And I think this is that desire to be a good girl or a good boy. This good girl or good boy complex is always about anxiety. People like this have problems with anxiety. Another feeling I want to draw your attention to is shame. My clients tell me that when they go out into society, where there are a lot of people, like in a supermarket, or when they go to work, they experience a kind of subconscious anxiety, and they are constantly focused on how they look, what people think, how people are looking at them. And all of this is directly connected to shame. And it so hits a kind of total shame about one's own existence. In other words, I'm somehow defective, I'm somehow not right. I'm very different from normal people. This kind of mindset is formed specifically in childhood, when a child is humiliated, when a child is judged, when a child is compared to other children, mocked, or when shame is used as a tool. Shame. Aren't you ashamed of yourself? You did this. That's not nice. By the way, those people who struggle with feelings of guilt were often raised in childhood through manipulative methods that pressured their sense of guilt. These are reproaches, accusations, a mother's hurt feelings. For example, when the mother pretended to be offended. All of this led to the person developing a problem with avoiding this feeling of guilt. And this leads to anxiety. So remember, there is always some unconscious feeling behind anxiety. And in order to become aware of this feeling, you need to dive very deeply into yourself, so that every time this feeling of anxiety or worry arises, you can associate this state with a specific feeling. And as always, at the end of the video, I ask you to subscribe to my channel, give this video a like if you found it useful, and write comments that are more than 7 words long, because for some reason YouTube only counts comments that are longer than 7 words. And I am very grateful to you for your attention, for your engagement, and I am already preparing a new episode for you.